I'm Dr. Cath Watson, and today PD Insurance has asked me to talk to you about separation anxiety. Yes, it's real, it happens. More importantly, anecdotally, we'd say it's happened even more since the COVID lockdowns from 2020. A lot of people decided to get a new pet at that point, and obviously everybody was at home. When we all had to go back to work, suddenly we've got a cat or a dog or any other pet that's used to having us around all the time, and suddenly we're not. So separation anxiety can be person specific, or it can actually just be being on their own. And like I say, the COVID separation is more about being on their own. It's of concern, and particularly in dogs, because they can be highly destructive. And in that destruction, it can end up being damage to physical things, so around the house. There's certainly dogs are known to break through windows, try and bash down doors, chew things, dig, try and hide in places. But it can also cause injury to them. And obviously coming home to a house filled with blood because your dog has worn its toenails away or cut itself on glass, it's not much fun, and that's a really big clean-up job, but obviously also really concerning to the dog, and they're likely to need some treatment for injuries. But also the chronic stress that comes with being anxious all the time is much more likely to lead to stress-related illnesses down the track and potential other behavioural problems. So really, really important that separation anxiety is recognised as a problem, or that you recognise that your dog's behaviour is a problem, and then get help. You're going to need help to understand the triggers and how to manage those triggers, how to teach them to be alone, because it's not something we can just expect that they're going to be okay with, particularly not when they're causing damage to themselves and the environment. But also making sure that they learn that they have safe places and have behavioural enrichment, things to do, so that they learn that when they are on their own, actually life's okay. So I would strongly recommend getting help for this. Please go and see a veterinarian, because it may be that medication is required as well. Dogs that are highly wound up in an anxious state actually are not in the best position to be learning, and medication can often help with that. But more importantly, get a behaviourist involved, an accredited behaviourist, to help you identify whether it is actually separation anxiety or whether it's some other behavioural issue that you may need help with. And secondly, how to best manage that problem so life is good for everybody at home.